Have you ever wondered why some positions feel incredible while others just don't hit the same? You're not alone. Many couples come to my clinic asking the same question. Why can't I climax easily even when everything else feels right? It's not about attraction, it's not about effort, it's about science. You see, female pleasure depends on anatomy, the angle, friction, and how the body's sensitive areas align during intimacy. And most people don't realize this. That's why some positions make you feel connected but not stimulated enough. Others might bring pleasure too quickly or feel uncomfortable. But here's the truth. There are specific positions that optimize contact with the clitoral network and internal pleasure zones. When you understand these, everything changes. You don't need to try harder. You just need to work smarter with your body. In this video, I'll share 4 doctor-backed sex positions that help women reach orgasm faster, not by luck, but by design. These are based on medical research, pelvic anatomy, and years of clinical experience helping couples improve their sexual satisfaction. If you've ever felt frustrated or if you simply want deeper, more connected pleasure, stay with me. By the end of this video, you'll understand exactly why these positions work and how to make every moment count for both of you. Let's be honest. When it comes to female pleasure, confusion is everywhere. Magazines, social media, even movies. They make it look effortless. But real intimacy isn't like that. It's often filled with quiet questions and unspoken frustration. Maybe you've thought, why can't I climax as easily as my partner? Or maybe you've pretended to finish just to avoid disappointment. If that sounds familiar, you're far from alone. In fact, studies show that nearly 70% of women rarely reach orgasm during intercourse. That's not because something's wrong with you. It's because most sexual positions are designed around male pleasure, not female anatomy. The truth is, women's sexual response is complex. It involves the clitoris, vaginal walls, pelvic muscles, even psychological factors like relaxation and trust. And yet, so few people are ever taught how these really work together. Here's the thing. The female clitoral network isn't just a tiny button. It's a large internal structure that wraps around the vaginal canal, almost like a wishbone. Certain angles and movements activate it more fully. Others miss it completely. So when couples say, we have great chemistry, but something's missing, the issue is often mechanical, not emotional. That's why understanding your body and choosing the right positions can completely transform your experience. It's not about performance or comparison. It's about awareness. When you know how pleasure really works, you stop guessing. You stop feeling broken. You start taking ownership of your own body. And that's where true intimacy begins, when pleasure is shared, not forced. So in a moment, I'll walk you through 4 science-backed sex positions that enhance female orgasm. They're simple, natural, and grounded in anatomy, not fantasy. Each one helps align the body for better stimulation, deeper connection, and more confidence in your sexual well-being. Because pleasure isn't a mystery, it's biology. And once you understand it, everything changes. Let's go step by step. Here are 4 doctor-backed sex positions that increase the likelihood of orgasm, based on anatomy, muscle engagement, and real research on clitoral stimulation. These are not about acrobatics. They're about alignment, connection, and comfort. Let's start simple. 1. The modified Missionary. Angle of contact. You've seen this one before, but the details make the difference. When a woman places a small pillow under her hips during Missionary, it changes everything. That lift tilts the pelvis upward, aligning the clitoral hood and internal network with the base of the penis. Why does this matter? Because most of the clitoris is actually internal. It extends down the vaginal walls. This angle helps stimulate those deeper branches, not just surface friction. For the partner, it also reduces the thrusting distance, allowing slower, more controlled movement. Less pounding, more connection. I often tell my patients, it's not about speed, it's about precision. This position gives both partners eye contact and intimacy, while giving the woman a better chance to climax through internal and external stimulation combined. If you want to enhance it even further, try gentle circular motion instead of straight thrusts. It mimics how the clitoris is naturally stimulated. 2. Woman on top, control and awareness. Now this one is powerful, both physically and psychologically. When the woman is on top, she controls the depth, rhythm, and pressure. That control helps relax the pelvic floor, reduces anxiety, and increases confidence. Medically speaking, it also allows her to angle her body for optimal stimulation of the clitoral legs, located around the vaginal opening. A small forward lean, where the woman's pelvis slides gently against her partner's pubic bone, stimulates both the clitoris and the anterior vaginal wall, the area rich in nerve endings often associated with the G-spot. I encourage couples to pause, breathe, and find what feels natural. It's not a performance, it's exploration. When you slow down, you actually heighten sensitivity. This position is also great for communication. When you're facing each other, it's easier to give feedback, to say what feels good and what doesn't. That openness builds trust, which is essential for real pleasure. 3. The spooning position, comfort and deep connection. This position is gentle, relaxed, and ideal for couples who value closeness. It's not about intensity, it's about comfort, rhythm, and connection. When both partners lie on their sides, the angle of entry is shallower. That means more friction on the front vaginal wall, again, closer to the clitoral network. Because the body is supported, there's no tension in the lower back or thighs. The woman can adjust the tilt of her hips to increase or soften stimulation. It also allows for subtle hand or clitoral stimulation during penetration without breaking the moment. From a physiological point of view, spooning helps maintain steady blood flow to the genital area, which sustains arousal longer. It also supports emotional safety. You're close, skin to skin, moving together. And remember, orgasm isn't just a physical reflex. It's a state of deep relaxation and trust. This position makes space for that. 4. The edge of the bed, precision and gravity. This one uses simple anatomy and gravity to your advantage. The woman lies at the edge of the bed with her legs slightly bent and feet resting flat on the mattress. Her partner stands or kneels between them. This position provides deep yet controlled penetration. It lets the partner adjust angle and pressure easily, targeting the internal clitoral bulbs and G-spot region. Medically, the reason this works is pelvic tilt. When the hips are elevated, the angle aligns perfectly with the front vaginal wall, where most nerve endings concentrate. It's also a great position for couples dealing with fatigue or lower back pain, since there's less strain and more stability. You can add gentle manual stimulation, a thumb or finger near the clitoral hood, to combine internal and external pleasure. That combination activates more of the clitoral network, leading to stronger, more consistent orgasms. A few doctor's notes on pleasure. Remember, everyone's anatomy is slightly different. What works for one person may feel different for another. That's completely normal. The key is communication and curiosity. Ask, does this feel better? Or should we change the angle? These small adjustments can have a huge impact. Also, don't underestimate foreplay. It's not optional. It increases blood flow, activates the pelvic nerves, and makes orgasm physiologically easier. In fact, the clitoris swells during arousal just like the penis, and that takes time, so don't rush it. Take moments to breathe, touch, and explore. Sex isn't just a physical act, it's emotional calibration. Your body listens when your mind feels safe. And for anyone struggling with confidence or performance anxiety, please remember, orgasm is not a test. It's a biological rhythm. It happens most naturally when the body feels relaxed, not pressured. These 4 positions aren't tricks. They're tools to understand your body better. They help you tune into how your pelvis moves, how your muscles contract, and how connection feels when it's balanced between both partners. The goal isn't just orgasm, it's pleasure with awareness. When you learn to connect anatomy with emotion, that's when intimacy becomes truly satisfying. So, let's take a moment to bring it all together. We talked about 4 science-backed positions that can help women reach orgasm more naturally, more often, and with more connection. First, the modified Missionary, where a small tilt changes everything. That simple pillow under the hips isn't just for comfort. It's an anatomical shift that brings the clitoral network closer to contact. When you slow down and focus on movement, not force, pleasure flows more evenly. Second, the woman on top, where confidence meets control. Here, awareness is power. When she moves in a way that feels right, not rushed, the body responds with sensitivity instead of tension. It's the most empowering position because it gives her permission to lead, explore, and express what feels good. Third, the spooning position, the reminder that intimacy doesn't always need intensity. It's gentle, supportive, and perfect for emotional closeness. It also proves that relaxation and trust are just as powerful as physical stimulation. And finally, the edge of the bed, a position that combines precision with comfort. It uses gravity and angle to enhance stimulation while keeping the body supported and free from strain. Each of these positions works not because of magic, but because of mechanics. They respect the natural structure of the female body, the clitoral legs, the anterior wall, the pelvic tilt. But more importantly, they remind us that pleasure starts with understanding. It's about listening to your body, to your partner, to the quiet signals of comfort and desire. So the next time you're together, don't focus on doing it right. Focus on being present. Ask what feels good. Notice small changes in movement, breathing, or rhythm. That awareness is what transforms intimacy from routine to remarkable. Always remember, the most satisfying sex isn't the loudest or the longest. It's the one where both partners feel seen, safe, and connected. Your body knows how to feel pleasure. All it needs is patience, curiosity, and the right kind of care. If there's one message I want you to take from this video, it's this. Your pleasure matters, not as an afterthought, but as a vital part of your health. Understanding your body isn't indulgent, it's empowering. When you learn how your anatomy responds, you stop blaming yourself. You stop feeling less than, and you start creating intimacy that's real, built on trust, curiosity, and care. As a doctor, I've seen how this simple awareness transforms relationships. It rebuilds confidence, restores connection, and often brings back a spark that many couples thought they'd lost. So take your time, explore these positions, talk openly, laugh if it feels awkward. That's part of being human. The goal isn't perfection, it's presence. If you found this video helpful, I invite you to subscribe for more doctor-led insights on sexual health, confidence, and intimacy. I share medically accurate, compassionate advice to help you understand your body without shame, without myths, and without noise. Because when we talk honestly about pleasure, we talk honestly about health. I'm Dr. Rosalia Viterbo. Take care of your health and your heart. See you next time.